What's up, guys? Welcome to episode 72 of the unofficial NCLEX podcast. My name is Katie Kleber, and I am your host. This episode is entitled Follow Correct Policy and Procedures When Reporting a Patient with a Communicable Disease. So, when you have a patient that has some communicable disease, sometimes I think people just assume, okay, the physician knows and that's it. Well, there's actually specific things that are reportable conditions. So the CDC, the Center for Disease Control, needs to know, how many people are sick with blank. You think about when you watch the news during like flu season and they talk about how many people are infected with the flu in what areas. That's because we need to report that to them, and that's how they have these accurate numbers. And it's really important for surveillance. We've got to, from a public health standpoint, have a very close eye on many different diseases. So that's one of the things that is important to know and to do. There are policies and procedures we have to follow. So some hospitals, depending upon the size, if you have a patient that presents, let's say tuberculosis, we have a patient that presents with tuberculosis. So the physician knows we're doing everything we need to do for the patient, but I need to let the appropriate personnel outside of the physician about this disease. And at the hospitals I've worked at before, there was a process in place where I notify the infection prevention, people, and I'm pretty sure they're nurses. I can't remember off the top of my head. But then I just put in a call, hey, I got a patient that has this disease. And then they actually take care of contacting this. They'll do a chart review, and they end up contacting the CDC for us and chart that it has been done, because, they ask for specific information. It just makes sense for, a small group of people to do this, that do it all the time, so that they make sure the CDC gets the information they need, and it's not another task that the bedside nurse has to do. That actually is a very important and serious one that we don't want to get left behind. So by allowing another person to make sure we get it taken care of is very helpful. But you can't assume that every place is like that. You may need to do that, and you should have a policy and procedure in place for when this presents, and also reportable diseases. So very important. And you may also have to report to local and state governments, health officials as well. So that's why it's wonderful to have that, maybe infection prevention department, because they know that stuff inside and out. So that's essential. From a public health standpoint, it is essential for disease surveillance, so we know kind of what's going on. Flu is a great example of that. And when you go on the CDC's website, that you can quickly click on list of reportable conditions, and it's pretty extensive. When I looked at it, I was pretty surprised at actually how large that list was. So I want to encourage you maybe just to check that out, just so you have like an idea of it. But that's pretty much what you got to do. You got to let the right people within your hospital know, and either you or those people will contact the CDC and local or state health departments, and making sure that is taken care of appropriately. So that concludes episode 72, Follow Correct Policy and Procedures When Reporting a Patient with a Communicable Disease.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.